According to the World Health Organization, over 50% of Western medicine used today are derived from natural sources such as plants, fungi, and animals. These sources are turned into the medication we take today through studies on traditional medicines, screening of extracts, and ecological observations. Plants have generally been the most important natural source of medicine. This is due to plants producing secondary metabolites, which allow multiple disease pathways to be targeted effectively. Medicinal compounds that come from plants are alkaloids, which are used for pain relief and as sedatives, glycosides, which are used for heart conditions, phenols, which are used for antiseptic and anti-inflammatory purposes, and terpenoids, which are also used for antiseptic and inflammatory purposes. Fungi and bacteria are the key source of modern antibiotics, but aren't limited to this. Fungi produces compounds with several effects, such as competing with bacteria, which leads to antibiotics being formed, and affecting cell growth, which is useful in cancer treatments as well as immune therapy.
Morphine is a powerful opioid used to treat severe and moderate pain, typically used to treat injury and surgery after chronic cancer pain. It can be administered via IV, orally, through oral, sublingual, or bacterial route. Oral is used for immediate rapid pain relief, whereas sublingual is used for palliative care patients who either cannot swallow or to treat breakthrough pain. Bacterial is often slow-releasing and used to treat chronic pain without the need to swallow. Due to bioavailability, sublingual methods are poor compared to alternative sublingual medication, but it remains a reliable option for palliative care. IV administering is typically 0.1 to 0.2 milligrams per kilogram of body mass every hour as needed. It is considered a gold standard in pain management for children with severe pain that requires constant monitoring. Due to its high addiction potential and history of misuse and overdosing, it is a Schedule II controlled substance, which means it has a high addiction rate, but has accepted medical use. As a result, it has restricted prescriptions and no refills are allowed.
Morphine is a naturally occurring compound extracted from the plant Parva somniferum, commonly known as the opium poppy. Farmers make shallow cuts on unripe pods, allowing the sap to ooze out and dry into a sticky substance called opium. This raw opium contains several alkaloids, with morphine being the most pharmacologically important. Morphine is classed as an opioid alkaloid and acts on the nervous system to relieve pain. First isolated in 1804 by German pharmacist Friedrich Sertner. It was named after Morpheus, the Greek god of dreams, due to its sleep-inducing effects. Morphine became widely used in the 19th century as a powerful pain reliever. The invention of hypodermic syringe in the 1850s made it easier to administer, increasing its medical use. Morphine was extensively used during conflicts such as the American Civil War to treat wounded soldiers.
Chromatographic techniques. These are high-performance liquid chromatography or HPLC. They are used for morphine quantification in pharmaceutical and illicit samples. They are often paired with photodiode array detectors, and they can detect morphine at very low concentrations, which is useful for separating morphine from heroin impurities. They are applicable to polar compounds applied in drug testing. They are reliable and cost-effective, and they are less sensitive compared to mass spectrometry. For LCMS, or liquid chromatography mass spectrometry, these combine chromatography and mass spectrometry. They identify molecules based on mass overcharge. They are highly sensitive and specific. They identify morphine metabolites. You need to be highly skilled to use them. They are the gold standard for morphine analysis in biological matrices. Ultra high performance LCMS. These are faster and they are a higher resolution version of the LCMS. They are used for morphine and its metabolites analysis. They are more elaborate and time intensive, but they are excellent for complex samples. For gas chromatography, mass spectrometry, these are highly accurate, but they require differentiation as morphine isn't volatile. They are often commonly found in forensic labs for confirmatory testing. Electrochemical sensors. These are a newer, rapid, low-cost detection method. They use modified electrodes and can detect morphine at 0.0 micro levels. They are portable and low cost. Sample preparation techniques improve the accuracy. They isolate morphine from complex matrices. They are often paired with the analytical methods below, such as DLLME, and the accuracy is enhanced in the preparation of samples, and they are good for quick screening.
Morphine has been identified in the opium poppy. It needs to be isolated in a pure form before it can be used as a medicine. This is important because natural sources contain complex mixtures of many different compounds, not just the active drug. The first step is extraction. Organic solvents are used to remove morphine and other alkaloids from plant material, yielding a crude extract. At this stage, the extract still contains multiple substances. To separate morphine from this mixture, acid-base extraction is used. Morphine is a basic compound, meaning its solubility changes depending on pH. In acidic conditions, it becomes more soluble by forming a salt. In basic conditions, it becomes less soluble and can be separated out. This allows the selective isolation of morphine from other compounds. Further purification is then carried out using high-performance liquid chromatography and HPLC. This technique separates compounds based on their interactions with the stationary and mobile phases, allowing highly pure morphine to be obtained. Finally, analytical techniques such as mass spectrometry and nuclear magnetic resonance spectroscopy are used to confirm both the identity and purity of morphine. Overall, isolation is a key step in drug discovery, as it ensures that natural compounds can be transformed into safe, pure, and effective medicines.
Morphine causes constipation due to the activation of opioid receptors on the myenteric plexus, blocking gastric emptying. Morphine causes urinary retention by binding to the opioid receptors, acting as an agonist, which suppresses the contractility of the detrusor muscle. This blocks the urge and makes it more difficult to urinate. Morphine also causes respiratory depression, therefore is carefully monitored in patients post-operation. Morphine causes emesis as it stimulates the opioid receptors in the chemoreceptor trigger zone. Morphine may cause nausea, therefore is typically administered with antiemetics such as metoclopramide. Prolonged use of morphine typically leads to adrenal insufficiency and increases the risk of dependence and addiction. Therefore, at the end of treatment, the dose should be tapered gradually in order to prevent withdrawal symptoms. Morphine may also cause hypertension because it acts as a vasodilator, which reduces the systemic vascular resistance and can lead to dizziness when standing up.